and the title of the article, Comparison of the Effect of the Metabolic Syndrome and Multiple Traditional Cardiovascular Risk Factors on Vascular Function. The first author is Dr. Jing Li, who was a fellow here from China. My name is Amir Lerman. I'm a professor of medicine, consultant in the Division of Cardiovascular Diseases, and chair of research in the Cardiovascular Division. I'm going to talk to you today about a recent article we have in the Mayo Clinic Proceeding. This article is focused on the effect on the metabolic syndrome, which is a cluster of risk factors on the end organ of vascular function, which usually determine the effect of risk factor on the initiation of disease. In order to see the specific effect of this cluster of risk, which is metabolic syndrome, which comprise of several factors such as obesity, hypertension, hyperglycemia, low HDL, we compare the patient who carry this cluster of risk factors to patients who have traditional risk factors. Traditionally, we talk usually the one that were described in the Framingham, such as hypertension, hyperlipidemia alone, smoking, family history, and we check the effect of these two groups on endothelial function as was measured non-invasively by acceptable method of reactive hyperemia. What we found out is that the patient that have the cluster of metabolic syndrome, although overall has less number of risk factors, has more effect on endothelial function, has more impact on vascular dysfunction, creating vascular dysfunction than the traditional risk factors. Why do we think this is important? There is a shift in what we see in the risk factors in the population, and we see more and more increased incidence of metabolic syndrome and progression of diabetes, mainly in our population that has obesity. And then we think that this study will allow us to again demonstrate that metabolic syndrome has impact on the disease, participate and contribute to the progression of disease and plaque formation, potentially cardiovascular event, but also have a positive effect in the sense that it gives us an opportunity for the reversal and treatment of this disease in this specific patient. Thus, although the message of this paper may be a little bit negative, saying that the metabolic syndrome has a negative effect on vascular function and that contribute to atherosclerosis and cardiovascular event, it still can be reversible, especially in the early age, and we can use the effect on vascular function and specifically on endothelial function to determine the positive effect of treatment and reduction of risk factors and reduction of metabolic syndrome.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.